G'day everyone. So this is our level 2 knee exercise video. This one's more focused on functional movements and weight bearing movements. A lot of these you'll find what we call a closed chain exercise, where your feet's in contact with the ground and you're actually kind of creating active movement that's going to be similar to what we do within the real world. So our first exercise is going to be a squat. Now most people know what a squat is. But there's some very specific things that we want you to make sure that you're doing so that we don't put extra stress on the knee or the lower back or any other part of the body. So the first thing is take a nice comfortable hip width or a little bit wider stance. Sometimes some people who are a little bit tight through the hips and groin and so forth need to take more of a frog leg stance where your feet are pointing out a little bit. If that's the case, that's something that your therapist will go through, and that's a good modification that we can make in your case. So the first things first, making sure when we squat down that our knees don't shear forward in front of our toes, because that puts a lot of stress on around the kneecaps and the knee itself, okay? And again, making sure as well we don't bend the back. So we want to make sure the back's nice and straight, our bum's dropping straight down, and then our knees don't shear forwards. The best way to keep your balance with this is to put your hands out in front. So as we squat down, you'll notice I'm creating like a nice position there, knees nice and wide, keeping the back nice and straight, getting quite deep, really working the glutes, working the quadriceps and all of those functional muscles in the lower limb, alright? So really incorporating everything together, coming up and down nice and easy like so. I like to look at the horizon rather than looking down at the ground, and that way I get that nice positive type of squat where we're really kind of targeting all of those muscles. Now if I turn to face you whilst we're doing that, you can see, of course, of the tightness that I have in my hips, I like to turn the toes out a little bit and take that wider stance, and then as we squat down like so. And that makes sure that my knees are chasing my toes or the midline of my foot, okay? If you're standing like in a nice straight line as if your feet are on train tracks, what we don't want to see is your knees coming inwards, because that obviously puts a lot of stress on the knees themselves. So when we do that, again, making sure that our knees are chasing towards the midline of the foot, alright? Making sure we're sticking the backside out as if you're about to sit down on a chair, but we've got our hands out in front to help us balance. Alright? One of the other variables we can do with this one, because just like anything, there's a number of different ways of doing things. We can do it up against a wall or do a wall slide. So, up against the wall like so. You can use a pillow or a rolled up towel or a small soccer ball, popping that between the knees. Stabilising like so, sort of squeezing and holding on that, okay, and that sort of really targets the inside muscles of the thigh. And then hands out if you want, or you can stabilise like so, sliding down the wall, keeping the weight nice and even through the feet and sort of focusing in on the heels, keeping the back against the wall like so, so we don't come off the wall, and I can really feel that working through my quads there, and then coming back up. Now, again, there's different ways of doing this. Your therapist may get you to do it repetitively like I'm doing now, or you may want to hold there in a specific position at a specific angle depending on what sport or what injury that you do have. Alright? So there's a number of different ways of doing that one, so be sure to pay close attention to what your therapist says, and that way we'll be able to make sure that we're targeting the part of the knees that we really want to. Alright? Now the next exercise we call the heel toe, alright? It's a bit of almost country music dancing, so bear with me. So the idea of this one is to stabilise the quad and stabilise the knee. It's going to stop us wanting to deviate inwards, okay? But at the same time, it's going to teach us actually part of that normal walking or gait pattern. So we put our weight back into the back corner of our heel that we're standing on. So in this case, you'll see I'm back in the back right corner of my heel there. Keeping that weight on, so it's almost like a semi-one-legged squat, really focusing on the glutes, not letting the knee go forwards. And then, in order to add a little bit of functionality and challenge the body, we do the heel toe. So we touch our heel forwards, and then we touch our toe backwards. Keeping that in that right spot, and then working forward and backwards like so. Now as I do this, I can really feel it burning through my quad, but most importantly, I'm getting the glutes involved in stabilising what that knee's doing. So you can see as I do that, to make it harder, I just move that leg further and further, and you'll notice, see my knees not moving? I'm not sort of swinging side to side or going forward and backwards. It's teaching me to be stable during that movement. If I face towards you and do that, you'll see it again. I'm across and back, okay, back on that right corner of the heel. If I was doing the left side, obviously I'd do the opposite, and then we tap forward and backwards. Notice I move the hands as if I'm in that running motion, so opposite hand forward as the foot comes forward, and then same foot as it goes backwards. So we go forward and backwards like so, just stabilising, keeping that knee nice and still, not having it go in and out, which is actually, you know, quite a challenge when you've got a knee problem. All right, now, next exercise. We've got a little step here, okay, so you can do this on a set of stairs at home. So as we stand up on here, this is going to be what we call a step down, okay? So rather than step up, we're actually focusing on the downward movement. So as we stand here, there's two ways of doing it. You can either do it as if you're pointing off the edge of the set of stairs, if the stairs were going down towards the camera. So I basically squat down, touch, and then back up again. Squat, touch, and back up. So you can see I'm kind of tapping the heel on the end there. And to make it harder, I just go lower, so I tap further and further down. Alright? Again, we can hold there for a specific length of time to actually make things more challenging, or we can just do straight up repetitions, depending on how many reps and sets and so forth that we're going to get you to do. Similarly, if we want, we can stand sideways on the step, where we start up nice and high, and then again, dropping forwards and back up. Now you can see it's exactly the same movement, in that my heel's coming forwards. I'm not trying to squat and go that way, because you can see as soon as I do, my knee goes forward over the toes, which is bad news. So we've got to keep the weight back on the heel as we go down, and that's going to help sort of stabilise everything. There's a degree of balance involved with this one, so it's quite a good little exercise to ensure that we're getting everything working well. Alright, now for the next exercise, we're doing some lunges. Now, again, there's various ways of doing these. So I prefer to do what we call a reverse lunge. Classically, people do lunges and they're stepping forward and walking across a room. One of the dangers of that is that your foot is unbalanced and then we land and then we kind of got to get our balance back again before we kind of take off to do the next movement. So I prefer a reverse lunge. That way you'll notice here when I do this, my right foot is actually well planted on the ground. I've already got my balance before I lift that other foot up, and then I move backwards like so. You'll notice there's different ways of targeting different aspects of the thigh and the glutes and so forth. I prefer to keep my weight through the heel, coming down, keeping the weight up like so, and then back up again. Alright? So really sort of working like so. Now you might reverse, as in do the opposite leg, okay, and alternate, or you could just do 10 in a row on one side, 10 in a row on the other side, just depending, again, on what your therapist is wanting to achieve. Similarly, you might put more weight on the back leg to try and get lower and lower, try to get that knee down towards the ground. You'll see my flexibility isn't quite good enough to do that, but like I said, the lower we get, we can work this leg here, controlling through there, controlling through here and down into the leg. Alright? Now, to add challenge to that, we can use some TheraBand. Alright? Now you can make a little loop out of this, which will loop around your knee or through your shin, and then you hook it around a table. Now either yourself or a family member or a friend can hold that for you, and as we do that lunge, be trying to pull your knee inwards so that you're going to fight to keep that nice and square as we lunge down into that position. Alright? So that's another functional way of controlling that movement and really making you work harder in order to keep that knee on that nice straight line through the midline of the foot. Okay? So there's different ways of doing those things, and it just depends on where you're at, so that's what your therapist can go through with you. Alright, now the last exercise we call the pink flamingo. Alright, now we've done a lot of work in this series working on the quads, working on the glutes, working on all those stabiliser mechanisms and all the synergist muscles. What we want to target here is now a bit of the hamstring and get that working with some of the other muscle groups. So, to do that, I'm going to do this with the left side just so that I've got somewhere to swing my leg. So you'll see I've got just a small weight, a 4 kilo weight here. Kettlebell, you can use a dumbbell, you can use anything. So essentially you want something to hang on to, like a table. So you'll see as I go forward here, I've got this table just to balance on. Now the key with it is don't put all your weight on the table. You just want a couple of fingers just to control your balance as we go down. You notice I kick this leg back. It keeps my back nice and straight so that we're not tempted to do this or doing this, okay? So keep the back straight and pivot about the hip. It's a bit like what we call a golfer's lift. How a golfer goes down and picks up the ball out of the hole. This is exactly what we're doing here. Now as we do it, if we keep the weight back on the heel, you'll notice you really use your hamstring to help pivot yourself back up. Alright? Now to make this harder, of course, you just pick up a heavier weight, or you can start to add little holds into it, hold there for periods of time, pausing at different points, depending on what we're trying to achieve functionally. So that works quite well. Like I said, you can do it if you don't have a table or something to hang on to. You can do it up against a wall and just slide your hand down the wall as we go. Alright? So that's quite a good little exercise series. All of them very functional, all of them very adaptable to what you need to do depending on your sport or what activities you're doing. Thank you.